you for your enthusiasm. Ladies and gentlemen, we do hope you had an insightful day one for the engaging in discussions and meaningful networking. Today, we are diving even deeper into key themes, health and medicine in the colonial, post-colonial, and global worlds. Before we begin, let's take a moment to acknowledge the tireless efforts of our organizing committee, partner institutions, and volunteers who make Homesick 2025 possible. And thanks to Professor Laksono, Ms. Aulia, and team for providing media publication about Homesick 2025. Website Sejarah Kesehatan.net. Please give a round of applause to them. Ladies and gentlemen, before we start the program, let me inform you about some announcements. First, we are pleased to inform you that this evening there will be an excursion arranged for registered participants. The program will include a visit to Sono Budaya Museum, and then followed by a delightful dinner at Dalam Pinakawan and enjoying the wayang kulit performance. The excursion will begin promptly at 4 p.m., so please be ready at the designated meeting point by that time. Transportation will be provided. This program is exclusively for those who have registered in advance, but we will open to you who want to join this program to register today in limited seats. Please scan barcode on screen or just please contact our committee for more information. And the second announcement, today we will have 2 books launching in the morning, and in the afternoon after break, we invite all of you to join this book launching session. Ladies and gentlemen, now we move forward a special segment, the remarks on the book presentation. And before we proceed into the book presentation and discussion, we are honored to share a pre-recorded message from a key figure in Indonesia's health sector. Please join me in welcoming to this video message His Excellency, the Minister of Health of the Republic of Indonesia, who will deliver his remarks. Let us now turn our attention to the screen. Mr. Budi Gunadi Sadikin.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua. Shalom, Om Swastiastu, Namo Buddhaya, salam kebajikan. Seringkali kita lupa akan sejarah atau menganggap bahwa sejarah kurang penting. Padahal begitu banyak manfaat yang dapat diraih dari mempelajari sejarah, termasuk dari mempelajari sejarah kebijakan kesehatan di Indonesia. Mempelajari sejarah bermanfaat tidak hanya untuk memperluas wawasan serta memahami konteks pengambilan suatu kebijakan, tetapi juga agar kita tidak mengulangi kembali kesalahan di masa lalu. Untuk itu saya menyambut dengan baik peluncuran buku Perkembangan Transformasi Kebijakan Kesehatan di Indonesia dari Reformasi hingga Pasca Covid 1999-2023. Yang telah disusun oleh tim kajian sejarah kebijakan kesehatan dari Pusat Kebijakan dan Manajemen Kesehatan Universitas Gadjah Mada, bekerja sama dengan Badan Kebijakan Pembangunan Kesehatan Kementerian Kesehatan. Saya berharap buku ini dapat memperkaya dialog sejarah dan sistem kesehatan di kawasan Asia Tenggara, serta menjadi rujukan di bidang kesehatan. Selamat berdiskusi dalam konferensi International History of Medicine in Southeast Asia ke-10. Semoga dialog yang terbangun pada hari ini dapat memberikan manfaat nyata bagi kemajuan sistem kesehatan Indonesia. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Om Santi 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 Om.
Thank you, Mr. Budi Gunadi Sadikin, Minister of Health of Republic of Indonesia. Ladies and gentlemen, next we move to book presentations. The book title is A Critical Evaluation on the Role of Government in Indonesia's National Health Policy from Reform to Post-COVID-19. And this session will be led by our moderator. And first we are on to have the book presented by none other than our keynote speakers, Dr. Abdul Wahid and Mr. Baha'Uddin, and our respondent, Professor Laksono. Please join me in welcoming Dr. Wahid, Mr. Uddin, and Professor Laksono. Please stay on stage. And we inform about the moderator. Let me read her short profile. She is Professor of Southeast Asian History at Southern Connecticut State University. Professor Thompson is an esteemed historian specializing in history of medicine and Southeast Asia. She is the author of the acclaimed monograph Vietnamese Traditional Medicine, a social history news press 2015, and has co-edited several influential volumes, including Fighting for Health, Medicine in Cold War Southeast Asia in 2024, and Translating the Body, Medical Education in Southeast Asia 2017. Her research spans topics from indigenous medical knowledge to the role of science and empire in colonial Southeast Asia. She has contributed numerous articles and translations to leading academic journals and compendia, and remains an active voice in scholarly conferences on global health history and environmental knowledge. Today, she brings her deep expertise to M.Sc 2025 as the moderator of this special session. And please join me in welcoming Professor Michele Thompson. And we hand over this session to Professor Michele.
Dr. Abdul Wahid, Dr. Baha'Uddin, who are both from the Department of History here at Gamaja, and Professor Laksono, who is a professor in the Faculty of Medicine at Public Policy and Nursing. So each speaker will have approximately 20 minutes, and then we hope to have a few minutes at the end for questions and answers.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, salam sejahtera untuk kita semua. First of all, we would like to thanks to M.Sc, especially Professor M.Phil, the president, and then also the organizer for giving us opportunity to introduce our books. The book is actually still in Bahasa Indonesia and will be in Bahasa Indonesia, so that's quite unfortunate for some of you. And we have some copies here, but still in limited number of books. And we are trying to persuade the Ministry of Health to make it available for public, for wider publics. But I think it's still on the process. So let's move to the slide. Next. All right, so this book is a product of a collaborative research between Department of History, Faculty of Cultural Sciences, UGM, Universitas Gadjah Mada, and Center for Health Policy and Management, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, and with the support of the Ministry of Health. So the book is a product actually of a collaborative works of a team which consists of experts from different disciplines. Of course, historians, two of us are historians, but also colleagues from medicine, public health, government and politics, economics, and law. So this is really like a multidisciplinary product of works. And next slide. We will introduce you briefly about the books. So our books actually adopting the WHO's 6 building blocks of health system as a framework. As many of you may know that this is really like a universal standard for understanding the health system in nations. So there are the six of them are service delivery, health workforce, health information system, access to essential medicine, financing, and leadership or governance. So this is the 6 building blocks that we cover in our books. And as a result, the book is very thick indeed. So it's like more or less like 600. And for that reason, actually, we will not able, I think, to explain the entirety of the books in such a very short time. So we'll talk on the certain part of the books only. Next. The books covers the 25 years of period since the 1999 until 2023. So for Indonesian audience may be familiar, it started from the so-called the Reformasi era, the political reformation started in after the fall of new orders until 2023, which actually the starting of new era later on. We will talk about that later. And the books basically, each of the sections divided into four periodizations. The first period, we call it the Reformations to Decentralization era, from 1999 until 2009. And then the second period, it's National Health Insurance or Jaminan Kesehatan Nasional period, 2009 until 2019. And the third period from 2020 to 2023, this is the COVID era. And then after that, 2003 until present, it's the health system transformations or the new era. And next, so what we are going to do in this occasion is we will talk only about the governance aspect, which is become the first part of the book. Please continue to the next slide to discuss further about how things going on during this period from political reform to decentralization, health sector. My colleague is going to discuss further.
The first period and the second period. The same period, Reformation period, various regulations have been drafted to underpin the practices in democracy in Indonesia. One of the reform agenda in 1999 was the implementation of democracy and decentralization. And one of the impact on this context was strengthening of the position of civil society organization and non-governmental organization as a counterbalance to state power and their ability to act as a bridge between the state and society. In the context of regional autonomy and decentralization, the government subsequently enacted Law Number 22 of 1999 and Law Number 32 of 2004, which regulate regional governance. Law Number 22 of 1999 reflect that regional autonomy is increasingly important to consider because it can bring to people closer to decision makers, prevent separatist movement, and enhance economic growth in regions to increase community participation in the development process. The authority granted by the central to local government covers most area of government except for foreign policy, defense, security, justice, national military and fiscal affairs, and religion. So the health sector must be decentralized. Since 1999, the health sector has been carried out by municipal or city governments. As a result of the decentralization policy, regional offices of the Ministry of Health were eliminated. Thus, provincial and municipal or city health offices carry out by decentralized functions of the central government for the health sector. Next slide. The Law Number 22 of 1999 then revised to Law Number 32 of 2004 have mandated the authority and power previously held by central government be transferred to local government. Meanwhile, Law Number 25 of 1999 mandates financial balancing between the central and local government. In the context for health sector, this legislation then became the basis for implementation of health decentralization policies in Indonesia. In addition to democratization, the objectives of the decentralization policy in Indonesia during this era were to achieve good public services, accommodate social and economic differences, distribute resources evenly, and improve the efficiency of regional development. During this period, law number 229 of 2004 on medical practice was also enacted, transferring some of government's authority in field of human resources to the Medical Association or Ikatan Dokter Indonesia or ID as a civil society organization. The implementation of this law has resulted in shifting in authority in the health sector to the left, so that the government no longer has strong authority in health sector. And another law that was enacted and had a significant impact on health services in Indonesia during this period was law number 1 of 2004. This law transferred authority over hospital services to the local government. The next slide. So, how has the decentralization policy been implemented in Indonesia since 1999? How decentralization policy have brought about radical change in the institutional structure within the Ministry of Health. Since 2000, the regional offices of the Ministry of Health have been since 2000, the since 2000, the regional offices of the Ministry of Health have been eliminated and merged into provincial and municipal or city health offices. The institutional restructuring has not been accompanied by an increase in the capacity of the central and regional government to implement fiscal and financial decentralization, especially for the financing of health services. The decentralization of health policy has a negative impact on Indonesia's health system, particularly in terms of coordination and division of rules between the central and regional government. This is caused in regulation on health decentralization policy to provide clear provisions regarding the division of rules in the health system between the central and local government. The agenda for public health development and the composition of the budget was almost entirely determined by the central government, leaving provincial and municipal governments with a little authority. As a result, fund absorption also declined. In the second period, a fundamental change occurred in health care services in Indonesia when National Health Insurance or Jaminan Kesehatan Nasional was implemented through Social Security Agency for Health or BPJS Kesehatan. During this period, the Indonesian government issued law number 40 of 2004 concerning the national social security system, which includes healthcare coverage, and Law Number 36 of 2009, which states that everyone has some right to access healthcare. Conversely, everyone almost must participate in the social health insurance program. Law Number 36 of 2009 encouraged democratization in health sector in Indonesia, whereby health management is carried out jointly by the central, local government, and society. This period was marked by enactment of Law Number 24 of 2011 on Social Security Agency or BPJS atau Badan Penyelenggara Jaminan Sosial, which officially came into effect on January 1st, 2014. The authority for health funding was transferred from the Ministry of Health to Social Security Agency for Health, which report directly to the President. The Ministry of Health no longer has oversight functions over the Social Security Agency for Health. And this period was also marked by enactment for many new laws in the health sector, one of which was Law Number 20 of 2013 on medical education. This law was drafted to address the weakness of the medical practice law, particularly the role of the state in education of doctors and medical specialists. Next. However, local government do not have authority over the National Health Insurance Program. And the National Health Insurance Program is fully delegated to the Social Security Agency and the central government. The Ministry of Health functions as a regulator of health insurance, while the Social Security Agency acts as the administrator and must coordinate with the Ministry of Health. The local government have limited authority in impose sanction on employers who have failed to fight Social Security Agency coverage for their employers. However, decentralization of health sector during the national health insurance period has not always been successful. Coordination between provincial and municipal or city government, for example, has not always run smoothly when there has been a change in the status of health facilities. In conclusion, during the first and second period, health reform in Indonesia had not yet been realized. Many health regulations were created that overlapped and ultimately failed to bring about a comprehensive national health system.
So I will continue with the last two periods. The third period is, next slide please, it's the period of COVID-19 pandemic. So the main purposes or the main health policies of the government, Indonesian government during the period is, of course, it's an adaptive strategy to measure the COVID pandemic, the impact of the COVID-19. But there are three, at least, big important policies during these difficult years. The first one is the collaborations in measuring the COVID-19. This policy was implemented through the formation of a COVID-19 task force under the coordination of National Committee for National Disaster Mitigations, and then the mobilization is, and then the improvement of health facilities capacity in the entire nation, in the entire country. And then the second one is the procurement of vaccine and pharmaceutical and health supplies to make sure that all the facilities, all the health service of the country can really, mitigate the pandemic. And then the last one is the developing a digital health information system, which is also to support, to create, the how you call it, the certainty of informations that would really help the building the trust of society to the government. Next slide, please. So during this period, actually, the task force COVID-19 did many programs to make sure that the COVID-19 impact can be really mitigated in the entire nations. And then what they did is actually they tried to coordinate it with other, ministerial but also non-ministerial agency. With some very important issue here is that the government really tried to introduce a legal basis for that, which is the Presidential Decree number 7, 2020, and then make sure that the coordinations of the pandemic management, it's really come into reality. And then the second one, interministerial institutional cooperations. The Ministry of Health work closely with various ministries and ministerial agency, including with TNI and the military and the police. And then the fulfillment of vaccine needs, so started to launch a national-wide vaccinations program with the help of international community. And then disseminations of COVID-19 information, so building information system concerning the COVID-19. And then in the same times also, of course, this is really difficult period, so the governments cannot tackle everything by themselves, so they really try to build also, to develop the cooperations with societal-based initiative. For example, but also for example, with the Ministry of Transportations using mobile health facility, and then the establishment of a special commission for national economic recovery. Because as we know that the pandemic is not only about health situations indeed, but also affecting almost the entire society, the entire life of society. International collaboration is also a very important issue during this pandemic era. The Minister of Health was trying to collaborate with the Ministry of Foreign Affairs and related minister, but also to try to get the international support, especially with the supply of vaccine, and also the diplomacy, and then especially the vaccine. Actually, that's the most important program. And then on national wide, the government also launched the so-called social distancing policies, and really try to avoid the total lockdown, which actually Indonesian government tried to develop its own social distancing policies, and they collaborate with local communities and grassroots level, and then really stimulating or promoting the community-based voluntary movement. Indonesian governments really claim that actually the quite successful in mitigating the pandemic COVID era. Although we have also read in the official report that during the pandemic, there are at least 71,000 Indonesians' lives has lost, and then, but that's still considered quite good considering the large country and the big numbers of Indonesian populations. Yet, on the other hand, after 2 years of period of the pandemic, then the evaluations, we evaluate the aftermath of the COVID. We can really see that actually COVID-19 is really like a wake-up call to Indonesian government, but also a big shock in a way, because it really revealed the very some foundational problems, which is coming actually resulted from the previous period. One of them is the lack of coordinations between the central government and local government, which is also have been there since the era of decentralizations. So the central government lose its capacity in coordinating because weakening, they lose some of the authority in managing the entire health, national health policy. Then, of course, also we really see that actually Indonesian national health system during the pandemic is not really ready for facing such huge problem as COVID-19 at the time. And for that reason, actually, in the coming period, in the next period, next slide, the Indonesian government really try to make sure that the national health policy can be improved. And one of the important policy is to launch the new laws, Undang-Undang the laws number 17, 2023, which is become a basic norm for Indonesian health system reform, try to strengthening the role, restoring actually the authority of the government, particularly the Ministry of Health, in coordinating and regulating the health sector by integrating various aspects of health services. Yet we have to stop there because we stopped our books in 2023. To what extent the new laws can really be implemented, that's still big questions, and then it's really started. Professor Laksono will talk about that in a minute, but this is really a history in the making process. So, but we will conclude with some really with some points. This next, okay. Anyway, so there are some problems. Next slide. The concluding remark. Okay, so the political reformations in 1990 brought about profound change in health policies and health government in Indonesia. The newly introduced law and regulation concerning health sector are partial in nature and overlapping one another. As a result, during the JKN period of 2009-2019, there was a regional inequality in the access of health service. The Ministry of Health underwent a weakening capacity in coordinating and synchronizing its health policy. And this has become the contributing factor to the nearly collapse of Indonesian health system during the COVID-19 pandemic. And learning from the past 2 decades experience, Indonesian government launched the new law on health in 2023, which tried to restore the central government's authority in managing health policy. So this is really like the points that we want to make at the end of our presentation. I will hand over again to Michele. Thank you.
Thank you very much, Dr. Abdul and Dr. Baha. We will now have about 10 minutes or so of discussion from Professor Laksono, and then we will have plenty of time for questions from the audience.
Okay, thank you. Yes, I think I would like to make some discussion based on my specialties. I'm not an historian. It's very important to be addressed. I'm actually a public health policy analyst. So my title is for the Trans-dicipline dialogue on history, health, medical sciences, and this is the public policy. And I think the term of public policy and history is always close together because we cannot have in-depth analysis of one policy if we don't know about the historical context of the policy. For example, if we look at the medical doctors' education in Indonesia, we can trace until the colonial period, and Pak Baha is the expert of the history of medical education because he researched on how the doctor was made in colonial time. Okay, so I'm from the Department of Health Policy and Management, the Faculty of Medicine, Public and Nursing. Slide, please. Remember yesterday, Pak Yudi, the Dean, remarks about jas merah. Don't forget the history or neglect the history. It is very important because our President Sukarno, the first president, is very famous of this kind of sentence. Yeah. Okay, and who are the users of history? Slide, please. And I think in this session, if we look at back to the what are our professions, we can see that at least we are actors in health system. We can be like hospital directors. Or can be the dean of medical school, or even social workers, so many things, yeah, many professions. And also public policy makers, or this is number 3 actually, like the minister, he opening our sessions, historians, Pak Baha and Pak Wahid, they are historians, and public health medical policy scientists, I'm here, yes. So when we look at back to the science of policy making. This is not also medical science, but from the policy sciences, we have some is actually who are the actors, like in a system that can be the supporters or the opponents of one policy. So when we look at the history of health policy everywhere in Indonesia, also in the world, also in US, you have big debate on Obamacare or not, I think 10, 15 years ago. And who won the debate? I don't know, it's confusing for me, yes. Oh, it's confusing for you too, yeah. Yes. And then the public policy makers, so the minister, the DGs, the chief of Dinas Kesehatan, so they are the policy makers, and they have to make policy every time. They have to be every year in the annual budgeting process, they have to make a decision. And historians, they don't do anything in policy making. Is that right? You are only observing. Yes. No influencing. Yes. Yeah, just. Yes. But you dig more resources, yeah, the digital resources or the library in the old, maybe 1,000 years ago. Yes. But you make analysis using historical research methods. That is very important. You have your historical research methods, okay? Yes, that's. And me, I'm a public scientist doing policy research and also trying to influence, that is the point. When the policy is still in the making or in the implementation, we are doing something to influence the policy. But we are also the object of the historian, that maybe Baha or Abdul Wahid will look at my opinion or my recommendation in the next 10 years, and my recommendation is so bad or so good, something like that. Okay, I'm also one of the object for historian. I'm not historian. Yeah. Slide, please. Yeah. So what Pak Baha and Pak Wahid described, this is about the current history of health policy, not the colonial period. That is very interesting. Pak Baha also make some research on the colonial time history of medical education or medical policy. All of the actors are already dead, okay? But if we look at this current historical study, so the policymakers still there, whether they are retired or maybe are not in the power again. So you can see that there is like a debate on this issue, because this is the current history, or I don't know what the current is like, notice to you, like contemporary historical study. In the last 25 years after political reform to before COVID-19, and then when we had the COVID-19 pandemic, and then after, and please, and stop in 2023. This is the point. This study stopped, yeah, ended at 2023 when the health law was stipulated. Yeah. Okay, this is a very important issue. Okay, and then click, please. Yes. Yes, this is the conclusion that Pak Wahid already mentioned. So the student makes statements. That's very interesting. That some people are not happy with this. For example, yeah, as a result, the regional governments were unable to improve their health policies, while the MOH experienced a weakening function coordinating and synchronizing the health policy on national level. Some people argue that, is this right, that MOH is weakening? When I was confronted of this issue, I said, yes, this is the historian statement, and I'm, as a policy analyst, yes, I'm thinking that MOH now is weak compared to 30 years ago. This is very interesting. That's like a debate. I said like a trans-discipline dialogue. But don't be angry for this dialogue. You have to be very cool, subtle, that there's something wrong. Why MOH cannot influence BPJS, just the National Health Insurance? Because the law mentioned that the director of BPJS is directly responsible to the president. There is no responsibility of BPJS director to the MOH, to the Minister of Health. That is funny thing. Yeah. So it is happening more than 10 years, okay. And then also we are almost collapsing during the pandemic-19 situation. That is happening, okay. So this is the historian statement. And agree, not agree, that is the statement, okay. Slide please, and what after 2023? And this is the point that now the history is in the making. Because after this is an English phrase that refers to a significant event or moment that is currently happening and will be remembered and recorded in the future as an important part of history. And this is the head law 2023. This is the history in the making. Yeah, this is something extraordinary or great things, groundbreaking, and so many terms for this law. Okay, this is the point. Slide please. And we are now in the implementation process. What's happening after 2023? And policymakers are busy for implementing. And the opponents can be, yes, very active also for rejecting this idea. And the public health scientists like me, active for researching the implementations. And the historian, you are observing, is that right? What's happening? Yes. And maybe you make historical analysis the next 3 years, 5 years, 10 years, or maybe 100 years after, when we already die. Yes. Is that right? Yes. Maybe, yeah, it's up to you, yeah. Okay, so, lastly, so this is my conclusion. Yes, please. So we have to look at the importance of history in health system development. This is very important, like Pak Karno mentioned. Yes, please. For example, for policymakers, yes, they have to be very careful of making decisions, because the judgment will be not this year, but maybe in the next 3, 4, 5 years, 10 years, 100 years again. You are a good policymaker or not, and judged by historian independently. Slide, please. Yeah. Also, for actors in health system, the pro and cons. If you are pro, then don't be like everything is okay. But if you are opponents of the policy, you have to be very careful. You are like sabotage or not. There's something like that can be written down by the historian. Slide, please. Yeah. And then policy scientists like me also, whether I can influence or not, whether my recommendation is good or bad, it is very interesting. We have to make a policy research that useful and will be also maybe used by a historian, okay? And then this is my last comment to the historian. Now, the point is how the degree of independence. Is it totally not independence or fully independence? I think you can make a judgment. So this book is funded by MOH, yeah. Okay, so it is fully independent. Let's talk. Yeah. Totally not independent. Yes, let's discuss. But in Indonesia, we don't have so much luxuries like in the US, that some philanthropy is aiming for granting some research fund to historical research, but not so many in Indonesia. And then also for historians, slide please, how the quality of the historical research, a good one or a poor one, excellent or so bad. Yeah. This is, I don't know how the peer mechanism in historian society. Is there any like peers that this is good, this is bad? Yeah. Okay, I think this is a thing that maybe let's discuss. Terima kasih. Thank you very much.
Now we have a good bit of time for questions. If people would raise their hands, I believe there is someone who can carry a microphone to them.
I had a question about BPGS. So in India, actually, we have something similar, Ayushman Bharat. But the problem is it leads towards curative care. That is the health insurance system. That is, it gives incentives towards treatment, over-treatment. Do you have the same issue in Indonesia with the BPGS system? That is, or does it, or in other words, does it militate against the UHC, Universal Health Coverage?
Oh yeah, well, the financial aspect is also part of the books. BPJS is one of our system actually developed later, because initially it's we have social security, something like that, and then I think there are so many issues indeed until now concerning the BPJS. It's about the coverage, but also there are some how you call it, fraud that we encounter on the field as well. But in general, actually, the government really tried to improve the BPJS system, and then also to the coverage, try to cover more and more, and then to different layers of society. But of course, there are some issue here and there. But one of the big issues is actually now, because the government have to take over the burden of the BPJS. The government run out the budget, actually, allocations, and they need to pay to, for example, to health providers, to the hospital, etc., which is exceeding the allocations that initially allocated for the budget. And there are some issues here and there that is also connected with maladministrations, but also the some administrative problems in how people accessing the basic universal care, actually. Pauline, can you maybe?
Yeah, I think this health insurance is very technically complicated, and this is the problem of historian, to understand the technical complications of health insurance. So, but we have to have this history of health insurance, say, in Indonesia. That's why historians should work together with some technical expert in health insurance. But I think the writer should be historian, not the technical expert in health insurance that provide like the history of health insurance. That's not right. Okay? Thank you.
Thank you very much. My name is M.Hum from the University of Manchester. I would first like to say congratulations on the publication of the book. I hope it will be accessible. I'm trying to learn Bahasa Indonesia, but I think it will take me a while to understand the whole book. But in any case, my question has to do with doing recent history, where a lot of the materials are available digitally. So the question is, archiving digital materials. Is there any attempt within Indonesia that try to archive digitalized health materials, health policy-related materials? And yeah, if so, how is it?
Well, the standard, for example, to look at how historical sources related with the health issue available for public is we have to look at the National Archives of Indonesia collections. And so far, to my knowledge, they have quite rich materials, but that's related with the colonial period, which is quite ironic, actually, because the post-colonial period sources is lesser, and then and even more so if we try to get one in the more current period, for example. I think we do really hope that the government really pay attention to this. Actually, there is a law, stipulated about the information and then the archiving. The law stipulated that all departments, governmental departments and ministry, there's an obligation for them to give their records, for example, their archives to the National Archives after 25 years. But I think I have so many colleagues in the National Archive. They say that the law is not really implemented, properly right now. So only several ministry who really deliver their archives to the National Archives of Indonesia. So in that sense, indeed, the option is a digital option, the digital sources. But that's also still very limited, I have to say, I have to admit. Maybe some of our Indonesian historian here can give more information about this. So that's the general thing that I could, the general answer to your questions. So we are really struggling, actually, to find sources for this book, actually, which is quite funny because we are working for the ministry, but the ministry doesn't have really a good archival system. So we have to collect somewhere else sometimes, and then And especially for example with the very technical things like BPJS that the previous questions has right. It's very difficult to find, especially the implementation of BPJS on local level. Indonesia is very huge, you know, and then with I think we really need like a really big push to start digitizing the sources, the administrative sources. I mean, the administration of the Indonesian government in every department, actually, not only health department. Baha'uddin, can get more? Okay. So, thank you.
Thank you very much, Bapak-Bapak yang saya hormati. My name is Yudil from Kyoto University. The book has a special focus on COVID, ya, Pak, ya, the period 3, as you mentioned. But because we are learning from history, just merah, Pak, is there any focus on our previous pandemic, HIV/AIDS, Pak? Because we know the pandemic starts in 80s, 90s, but there's a lot of policy changes in the 2000s, especially for HIV, especially in the period of Bu Nafsiyah and KPAN, AIDS Commission. Are there any focus on HIV policy, Pak, in the book? Thank you. HIV, yes.
Okay, one thing we have to, to say that the book is really like a source book. It's we're trying to map out only the map of the big, the important policies in Indonesia related with the health policy. We do have section in the book to deal with the how you call it, the transmitting disease and also non-communicable. Yes, so penyakit menular dan penyakit non-menular. So there are some there was a section about that in book, but of course, we only very touch it maybe in very general way. We only try to provide the mapping, the important policies, the important programs that the government introduced since the Ibu Nafsiyah Mboe, since even before sometimes like that. So we really suggest maybe if you have chance to see the books and then see actually there are some issues that really needs to be studied further in more detail and in different localities in Indonesia. So it's really like a big book, try to cover the nationwide policies, and then you can imagine there's so many details that has been left out from the books. But that doesn't really mean because by intention, I mean because we need more study actually to cover everything, but which is simply doesn't, it's simply impossible to do that actually. Yeah.
Yeah, I can have one. Yes, I think this is the point that this book is only like superficial actually. If we want to have a deeper analysis, it can be 10,000 pages maybe. Yes, I for example, like we can have like the history of AIDS policy in Indonesia, 300 pages maybe, okay? Or the history of tuberculosis in Indonesia, or the history of medical education policy, the history of say cardiology services in Indonesia, so many things. Yeah. But we cannot go in deep in every program. So I hope the society will develop the future historical study on Indonesians' health problems. That's the point. Thank you.
Thank you so much for the opportunity. My name is Salma. I'm from Research Center of Care and Infectious Diseases.
Louder.
Oh, louder. Okay, sorry. I'm Salma. I'm from Research Center of Care and Infectious Diseases, Universitas Pajajaran, Unpad. And I have one question related about how exactly do we translate history into public policy, because I think I'm also a public health policy researcher in my institution, and there is this burning question on how do we translate history into not only a policy translation but also into an implemented action. Because one thing that COVID taught us is that so maybe COVID is not the only outbreak happened in Indonesia. We have MERS in 2005, we have SARS in 2002, and we also have swine flu in 2009. And it seems that one of the criticism in Indonesia COVID-19 response is that we are not really learning from the past history, past outbreaks, so how we address that criticism. I think, yeah, that would be my question. Thank you very much.
We have to be very clear about our mission is to make a research on policy, is that right? Yeah. And it is a very important issue that in Indonesia, the political situation or the health system situation is full of conflict. That is the point. The same with the US, I think with Obamacare. Yes, we are a democratic country, not like in China, okay? So now I just ask from my colleagues from the mental health. And there's a big conflict from mental health professions among psychologists and psychiatrists, yeah. And this is, I said to them, if we don't solve the problems, then the historian will write something on our conflicts. And how is our face in the future? We can be branded as profession that never think about the problem in society, but always thinking about internal conflicts. That is the point, yeah. So now, using historical perspective, I think that's my point, is we have to be very careful in current situation. Don't be involved in conflicting issue that people like Pak Wahid and Pak Baha'Uddin will be record us, not the angel. If we die, the angel, siapa namanya, Pak Malaikat Akib dan siapa itu ya, yang mencatat kita, they record us, but in the historical society, historian will record our activities, and the conflicting issue is the most interesting issue. Is that right? The conflicting, yes, like the history of war is always conflicting between this and that. The conflict between like countries or political parties make war, like this Iran and Israel, something like that. Is that right? Historians love to write something on this. Yeah, some of them. Yeah, itu Bu, yeah. So we have to be very clear in our missions, try to make to solve the problems now, other than let the problems becoming worse and worse, and then the historian will record us like we don't care anything, something like that, only conflicting. Yes, thank you.
Yeah, I just want to add a little bit from the point of view of historians, us working in the history department, for example. Actually, we try our best actually to convince our colleagues in the department, in the faculty of medicine, that let's make a collaborations doing research, because the big problem of this nation is historical amnesia. We tend to forget many things in the past. When the COVID-19 happened, actually, people suddenly try to look back at the past. Were there any kind of this global scale pandemic like this, and how at the time people reacted or coped with the problems? It's only by then they try to find out history, reach out us. And the record is there. My colleague, Rafando, for example, has published a book about global pandemic influenza flu in 1918s. And then that's become quite books at the time were really like a contribution to the people that to show that actually pandemic is not only now happening. There are pandemics in the past that we can learn actually as in our experience. And of course, for the perspective of for the public policy makers, they should learn that actually how people in the past, how our government in the past tackle the problems, and then we can do something really historic based on history, based on data, based on science, so to say, something like that. Thank you.
Ladies and gentlemen, it's now time for a special highlight of M.Sc 2025, the launch of a significant publication that brings together years of collaborative research and passion. The book, titled A Critical Evaluation on the Role of Government in Indonesia's National Health Policy from Reform to Post-COVID-19, that will be presented by Professor Laksono to President of M.Sc 2025. Professor Hans Pauls. And the other ceremonial copy of the book will be presented by Mr. Wahid to our moderator. Professor Michele. Next, we kindly invite all invitees on stage to have photos together. Please facing the camera and more closer each other, please. Okay. And showing the book to the camera, and we'll capture this special moment. 3, 2, 1. Okay, keep your thumb together, maybe like this. Yeah. Okay. 3, 2, 1. Thank you. Please give a big applause to M.Sc 2025, and this is the book launching. Thank you so very much, Professor Michele, Professor Laksono. Then we inform you about the parallel session. Will be. Oh yeah. Well, before that, please stay on stage. There is another procession that will be a token of appreciation that will be delivered by Professor Yayi to all speakers, moderator on stage. And then Mr. Baha'Uddin and then Professor Dr. Laksono Trisnantoro. And our moderator, Professor Yayi, will give the souvenir to the moderator. And next token of appreciation, we kindly invite Professor Harold, please the stage. Professor Harold T. Cook, please proceed to the stage. And we kindly invite Dr. Sri Awalia to deliver the token of appreciation. That's okay. Dr. Sri Awalia, please present the souvenir to Professor Hans Pels. Professor Harold, Professor Yayi, we kindly invite you back to the stage to have the photo session together. And Dr. Sri Awalia, please present the souvenir to the moderator. Please all invitees to stay on stage. There will be a photo session together. Once again with Professor Harold and Professor Hans Pels. Okay, please facing the camera once again, ladies and gentlemen. 3, 2, 1, capture. Once more, give your biggest smile. 1, 2, 3, Thank you so very much. Thank you so very much. And once again, we inform you about the next agenda, which is we will have coffee break for 30 minutes, starting from now until 10:45, and please proceed to the parallel session room at 10:40.